Hello, good afternoon. I'm Martin A. Agustin and answering the elbow side question 4. Set C. In examination of the patient with right ulnar collateral ligament repair, autogenous graft, who is a baseball player. Patient has a near ROM 3 plus over 5 in strength. However, the excessive force applied pain with 6 over 10 in pain scale and slightly give is experienced in the patient by the patient. So side question number 1, what criteria did you or will you use to determine whether the patient has met his or her goal? So in first, we would be focusing on the pain. So we would test it using the pain scale. If there is still pain, the next we'll be using is the FIM. If there is a movement that could imply there is still pain on the right ulnar collateral ligament, and also the FIM that could help us determine if the patient could move in doing his or her ADLs, and also MMT grade, just to be sure if there is no perfect or correct MMT grade for the patient, increased in strength, and also the testing for the instability. If there is still instability, we could still focus on doing there is no instability, therefore possible the patient could reach his or her goal. So we'll be focusing on pain, MMT, FIM, so that if we would be using those criteria in making sure that the patient can or able to do his ADLs and everything and reach his goals. Side question number 2, what barrier, physical, personal, environmental, if any, are there to discharge? So the barriers that we'll be talking about to the patient would be physical, would be personal and environmental. Personal because the patient is a sports player. Some players is a sports born, so we'll be focusing on the personal part, also that the patient has a willingness to play sports. And also environmental because the patient may be experiencing this pain or instability on his elbow because of the environmental factors that could prohibit him in doing or apprehend the pain and instability on his elbow. Side question number 3, how do you determine the patient is ready to return to home, community, work, school, and sports? Side 2 and explain. So we could determine the patient is ready to return to his doings would be if there is no pain on the affected area on the right ulnar collateral ligament, if there is no problem and the patient may feel okay towards the movement or the motion with our treatment. And also second is the patient would able to do ADL like ADLs at home and ADLs at work. Also the patient may also include the sport specific also, if the patient may able to do sports again without the apprehension of pain and the feeling of the give or instability in the shoulder in the elbow of the patient. So that's all.